Recovering from knee surgery is highly variable.
It was going to take forever to get better, if I was ever going to get better.
There's got to be something out there besides a CPM machine, which clearly isn't helping me.
Active and aggressive with this thing, or I was going to need
I'm a guy that's not looking to relieve the pain. I'm a guy that's looking to get back in the game.
That downtime was not what I wanted.
We've spent the last 7 years perfecting the recovery system that takes variability out of knee rehab, so you can quickly get back to your life.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery. The Value of Vitamin D Before Knee Surgery, written by Dr. Carl Freeman. Please visit the episode webpage for references and sources for the information provided in this article. In his article, Dr. Freeman writes, patients who are vitamin D deficient 90 days before having a total knee replacement have a 69% higher rate of manipulations under anesthesia, or MUA, a 76% higher rate of infection, and a threefold higher risk of prosthesis removal. Vitamin D deficient patients also had a 90% higher risk of deep vein thrombosis and twice the risk of heart attack. Vitamin D deficient patients also have an increased risk of falls, decreased muscle strength, and increased body sway. Taken together, vitamin D deficient patients have a higher risk of complications following surgery than those with adequate vitamin D. If you are considering a knee replacement surgery, I hope these facts have captured your attention, as these risks can easily be mitigated. Seniors are at higher risk for vitamin D deficiency because the ability to make vitamin D decreases with age, as does the ability to activate vitamin D in the kidneys. Many seniors have reduced exposure to sunlight because of spending much of their time indoors. If that were not enough, the amount of vitamin D needed increases with age. Below age 50, 200 international units, or IU, are recommended per day. From 50 to 70, 400 IUs are needed per day, and after age 70, this increases to 600 IUs per day. And then there is darker skin. In a study of South Asians and Africans from the Caribbean living in Britain, the rate of vitamin D deficiency ranged from 12.5% to over 42%. Your body makes vitamin D as a result of exposure to ultraviolet light and obtains vitamin D from eating foods such as salmon, tuna, trout, fortified milk or yogurt, or from dietary supplements. Determining the amount of vitamin D in your body requires a blood test. The limit for deficiency has changed. Until 2000, people were primarily concerned about rickets, also known as a deformed skeleton, in children, and softened skeletons in adults. These are severe effects, and since 2000, the studies indicate that the level for vitamin D deficiency should be increased from 8 nanograms per milliliter to 30 nanograms per milliliter, a nearly four-fold increase. The information cited in this blog refers to the older standard, and thus are extremely conservative. These risks stem from the multiple roles that vitamin D plays in the body: bone health and the functioning of muscles, the immune system, gut, kidneys, and brain. Vitamin D is important in bone health as it increases the absorption of calcium, phosphorus, and citrate in the bone. Vitamin D also regulates the amount of calcium and phosphorus ions in blood and the absorption in gut and the kidneys. If your blood calcium level drops, then the parathyroid gland releases a hormone which takes calcium out of bone, making the bone more brittle and prone to break, particularly in falls. Vitamin D increases the absorption of calcium into the blood and prevents the loss of calcium from the bone. Thus, for good bone health, we need to have adequate amounts of calcium, phosphorus, and vitamin D. While vitamin D's role in bone health is well known, what is less well known is the role that vitamin D plays in muscle strength. Vitamin D helps muscle contract, in short, work. Part of the typical loss of strength associated with aging is due to vitamin D deficiency. Vitamin D is also essential for maturing killer T cells in the immune system, and thus plays a pivotal role in the immune system's antibacterial response. Vitamin D also plays an important role in helping the gut absorb calcium and other minerals in the gut, and it also helps in the kidneys to activate calcium. I should also mention that vitamin D's role in the body is still an active area of research, particularly in bone health, the immune system, and even in neurology. We know it is important in the brain, but haven't worked out all the ways. Clearly, risk factors associated with vitamin D can be ameliorated by a simple blood test and a dietary supplement. Given the upside of having an adequate supply, I strongly urge all knee surgery patients to get the blood test, and if necessary, have a daily regime of vitamin D supplement. As one example, the author takes 6,000 IU a day, as he too was found to be vitamin D deficient. Visit our episode webpage for some interesting graphical support for this article, as well as links related to articles about diet and knee replacement surgery. Also, check out another podcast we love called A Doctor's Perspective with Dr. Justin Trosclair. More about that fascinating pod from Dr. Trosclair.
I'm Dr. Justin Trosclair, host of two-time Podcast Awards nominated A Doctor's Perspective podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.